Hi, good morning. Welcome to today's segment of the Health Corner on the Breakfast Show. I am Dr. Nakuya Namfaya. In today's topic, we are going to talk about the prevention of cholera. This week, we have been talking about cholera and how it is caused and some of the symptoms. Yesterday, we talked about how cholera is treated, and we discussed that cholera can be treated with antibiotics, but more especially the need for rehydration in patients who have cholera because it causes dehydration. So today we are going to talk about how you can prevent yourself from getting cholera. So good sanitation and hygiene is key in the prevention of cholera. And some of the things that you can do are, one, make sure that you wash your hands every time you use the bathroom or every time you want to eat your food. Make sure your hands are clean and washed with soap. If you are not able to wash your hands at the time, you can sanitize with an alcohol-based sanitizer. Secondly, make sure that you wash your fruits and your vegetables thoroughly before you can eat them or before you can cook them. Number three, make sure that you drink clean and safe water. You can do this by boiling the water that you drink or chlorinating the water that you drink. Make sure that the water is clean and safe for consumption. Number four, you need to cover your food every time you are done eating. Make sure that it is free from contamination, from flies, and cover your food. Make sure that your food is covered before and even after you finish eating to prevent it from being contaminated. Number five, make sure that you buy food from people that you trust and know that their hygiene is excellent. Do not buy food anyhow on the streets. You may never know where you can get the bacteria which causes cholera. Number six, ensure the proper use of toilets and pit latrines in our homes and in the public places. So this week we have been talking about cholera and we have learned so much about cholera. We have learned what it is, and cholera is an acute diarrheal disease that causes diarrhea, and it's caused by a bacterial infection that is called Vibrio cholerae. This infection gets into the intestines and causes one to lose a lot of water from the body. Cholera can have no symptoms, but sometimes it can cause severe symptoms that can cause dehydration and, if not treated, can cause organ damage and even death. Cholera can be treated, and it's important that you get help or get medical attention as soon as possible. As soon as you discover that you have cholera, it's important to go to the hospital. It can also be prevented by good sanitation and hygiene practices in our homes and in our communities. So make sure that you are washing your hands, make sure you are washing your food before you eat. Make sure that you are sanitizing your hands. Make sure that you cover your food and cook your food thoroughly and cook your food very well to prevent you from having cholera. When drinking water, make sure you're drinking water that is chlorinated or boiled. If you are not chlorinating, make sure you boil your water before you can drink it. So that has been what we have been learning about this week and what we have talked about this week. So I hope you have learned something, and I hope you will be able to practice good hygiene in your homes and in your communities to prevent cholera and to prevent the spread of cholera. This has been the Health Corner on the Breakfast Show on Camnet TV. Be sure to watch again next week. Thank you so much for tuning in.